Coronavirus infections across the U.S. are still on the way down, and more Americans are getting vaccinated. That is the good news. But health experts are warning these new variants that we've been hearing so much about could cause complications soon. Several predicting the highly contagious UK variant is likely to fuel another increase or surge of cases in just a matter of weeks. We are joined by Dr. David Rubin with Children's Hospital of Philadelphia's PolicyLab. Good morning to you, Dr. Rubin. It's so nice to have you back. Okay, so you guys have created this interactive map projecting the spread of COVID-19 that has been widely used during this pandemic. I want to ask you first how your tracking works and how accurate you found it to have been during this pandemic.
You know, our team at PolicyLab, we do a lot of careful validation. I think there are a lot of people who've been tracking the pandemic, but what we've done is been extremely careful never to project more than 4 weeks ahead, and have encouraged people to look at our series of forecasts in their entirety for your entire region, week to week. And if you see things getting worse over several weeks, that's pretty clear and convincing evidence. If you also see multiple areas in your region getting worse, that's convincing evidence. And the same thing goes for declines as well too. And then you can look at your emergency department visits, your hospitalizations, to get a fairly complete picture in terms of the risk to your region. Our models are heavily pegged to the rate of actual growth or decline in a region, and then we vary our forecast by the testing positivity we're seeing in a region, the amount of distancing that people are doing, the weather, and the seasonality. And so there's a lot that goes into it, but it's been a fairly reliable model throughout the year.
Well, let's talk about that. So now, as I just said at the top here, there are concerns this UK variant could cause a resurgence in mid-May to late May, early April. These health experts have been saying they're concerned about that. What is your forecast showing here?
Well, we're seeing really strong seasonal forces here in terms of the improvements towards spring and the weather warming up alongside building immunity, either through natural infection or via vaccination. And it's an emphasis on why those vaccinations are so important. And they seem to be overwhelming any proclivity for a lot of these variant strains that might be more transmissible to continue to propagate. But they're sort of opposing forces, and if we move too quickly, we can see some of the stalling that we saw in the last couple of weeks. And it's really a reminder that there's still a fair amount of risk out there, and the moves we make now as communities can really help to speed along these declines, but they can also result in quite the opposite, which is to sustain some of these peak moments with lots of people getting infected near the finish line. And I think that's what we're trying to prevent the most, even as we allow our economies to reopen now.
Yeah, and so I have two questions left for you, and that brings me to this one, which is, Texas is among 3 or 4 states now that is saying no more mask mandate. In your projections and your forecasting, did you see a pattern there with mask mandates and a decrease, or mask mandates and an increase, or nothing at all?
Actually, we have some pretty compelling data. It's still, we still have to go through peer review on it, but we have some compelling data of the value of mask mandates during periods of when incidence was really high. And look, we can debate the timing of when to make certain public policy moves, and certainly the South is aided by an earlier spring. But I think those communities that are a bit more incremental are going to be rewarded by more quickly declining transmission, particularly in the north of our country. Is make the moves to reopen your economy to help get more kids back to school, but rely on the most tried and true effective mitigation measure, which is public masking in public locations, to help make those moves before you get to the finish line and hopefully see a really tranquil summer.
Okay, I want to jump in because I only have time for one more question. What do you foresee for the Midwest here in Chicago? Good news to hear. Maybe you think those variants aren't going to be as bad as some of health experts are saying, but what do you see for our area?
Well, I think what we saw, some of the stalled improvements this past couple of weeks, we suspect it was from a long President's Day weekend, some of the gatherings that took place. I think as long as people kind of commit to doing the things they've learned, masking, keeping their gatherings smaller, I would suspect that Chicago's in a good place to see continued declines as you move towards later in spring and get back to a bit more normal like we saw before the pandemic.
Dr. David Rubin, that is great news with Children's Hospital of Philadelphia's PolicyLab. Thank you for joining me. Fascinating work that you guys are doing, so I'm so happy you came on to share that with us. We appreciate your time.
Oh, you're welcome.
Okay, have a great day. Coming up.